Before testing. Before the test is started, the technician will need to obtain some information from you. This includes your height and weight, so please make sure you wear shoes that are easy to take off. We will also be recording other necessary information, such as your ethnicity, smoking history, current medication, and reason for testing. It is a good idea to bring any relevant information with you. After all of this information has been obtained, you are ready to start your test. Spirometry testing. What is spirometry testing? This test primarily measures two things: how hard you can blow and how much air you are able to blow out, especially in the first second. This test is useful for identifying a potential blockage in your airways, which could be due to COPD or asthma. Please note, this test will be performed twice, both without and with a puffer, so please refer to our withholding guide on the website to see how long you should refrain from using your prescribed puffer. Here's how the test is performed.
Today we're going to show you how a spirometry test is performed. For this test, you're going to try and blow as hard as you can and keep blowing like that until your lungs are empty. Please note that you should tell us if you start feeling very dizzy, lightheaded, or if you feel like you have a headache coming on, as this might indicate that you should be taking a break between trials. All you're going to do for the test, put your peg on, get on the mouthpiece, and Jared's going to show you how this test is done. So Jared, just keep breathing normally. Now Jared, take a full breath in, as big as you can, and blow it out. Keep blowing, Jared, that's very good. And at the bottom, breathe in. Very good, Jared, take a break. And that's all.
Gas transfer testing. What is gas transfer testing? For this test, we will be checking how well gas exchange occurs between your lungs and your bloodstream. It is used as a medical aid to help identify lung diseases such as emphysema. To ensure accuracy, please refrain from smoking on the day of testing. Let's see how this test is done.
We're going to show you now how a gas transfer test is performed. This test is very relaxed, so please take your time and do not try and do this too quickly. To start with, Jared's going to put his nose peg on. He's going to get on the mouthpiece and he's going to breathe normally for a few breaths. So just keep breathing normally, Jared. Now, Jared is going to empty his lungs as much as he can, all the way down right to the bottom, and at the bottom he's going to take a full breath in and hold his breath. That's good. You're going to hold your breath for 8 seconds, Jared. So that's 5, 4, 3, 2, 1, and blow gently. Good. Keep blowing till there's nothing left and relax. That's all done.
Lung volume testing. What is lung volume testing? For this test, we will be looking at how big your lungs are. This is useful for seeing if your lungs are being restricted or if there is any gas trapping. Let's see the procedure for this test.
Today we're going to show you how to do a lung volume test. Before we start, please note that for this test, this door will need to be closed. So if you are claustrophobic or anxious with tight spaces, please let us know. You can open the door at any time during the test if you would like to do so. However, if you'd be more comfortable not doing this test, please inform us at the start. We'll close the door and then I'll show you how to do the test. Now, while the door is closing, it takes a few seconds for the box to stabilize, so just relax and we will tell you when it's ready. Now that it is ready, I'll get my assistant Jared to put his nose peg on, get on the mouthpiece by pulling it towards you, and just breathe normally. You'll be breathing normally for a few seconds, and then I'm going to get you to start panting. Very similar to a dog panting with a very shallow breath. In, out, in, out, in, out. This needs to be really gentle. This test is gentle the whole way through. So very gently, Jared, just pant in, out, in, out, in, out. That's good. Now, at this point, the mouthpiece is going to block for a few seconds, cutting your air off. While it is blocked, all you need to do is continue that panting maneuver and push and pull against the blockage. Sort of like puffing your cheeks in and out without actually puffing your cheeks up and down. So Jared, the mouthpiece is going to block and push, pull, push, pull. Very good. In 2 seconds, the blockage will open up again. And at this point, Jared's just going to take a full breath in all the way up. Good. And blow it all out, Jared. Keep blowing. And you'll keep blowing until his lungs are completely empty. And then get a full breath back in and go back to normal. That was perfect. Remember not to come off the mouthpiece at the end of the test. Even if you think you're done, we might still have more things for you to do. So make sure you keep your mouth nice and tight on that mouthpiece. Thank you.